If you're over 60 and waking up with that familiar ache in your lower back, or finding it harder to bend down to tie your shoes, get out of a chair without wincing, or even enjoy a simple walk with your grandchildren because of nagging back pain, you're far from alone, and it can feel downright discouraging. That constant discomfort can steal the joy from everyday moments, make you worry about losing your independence, and leave you wondering if this is just how life has to be now that you're getting older. Here's something that might concern you even more. Surveys from the Centers for Disease Control and Prevention show that nearly 40% of adults over 60 experience chronic back pain, and many believe it's an unavoidable part of aging that they just have to live with. Research from the National Institutes of Health confirms that back pain becomes one of the leading causes of limited mobility and reduced quality of life in our later years, quietly affecting sleep, mood, and the ability to do the things we love. But here's where it gets even more worrying. Most seniors are never told that a great deal of this pain isn't caused by serious disease or irreversible damage, but by simple muscle weaknesses that develop gradually over time and can often be improved safely at home. The good news, and the reason you're watching today, is that there is one highly effective exercise that research highlights as a standout way for people over 60 to reduce back pain, rebuild strength, and regain comfortable movement. It's gentle, can be done lying down, requires no equipment, and thousands of older adults have used it to feel real relief without risky treatments or endless appointments. And the best part? This isn't complicated or strenuous. It's a simple movement your body was designed to do, and once you start doing it regularly, many people notice positive changes in just a few weeks. Before we reveal this powerful exercise and show you exactly how to do it safely, if feeling more comfortable in your body and staying active and independent as you age truly matters to you, please take a gentle moment to like this video and subscribe to the channel. It helps more seniors just like you find reliable, caring guidance they can trust every week. Now let's talk calmly about what's really happening with back pain after 60, so you can feel informed and hopeful rather than worried. Most chronic back pain in older adults is what doctors call nonspecific or mechanical, meaning it's related to how we move, sit, and use our muscles day to day, rather than a serious condition. As we age, the discs between our vertebrae naturally lose a bit of hydration. Our core and glute muscles tend to weaken from less activity, and years of habitual posture can create imbalances that put extra strain on the lower back. Studies from the Mayo Clinic and large reviews published in medical journals show that up to 85–90% of back pain cases in adults over 60 have no identifiable serious pathology on imaging. It's often simply the result of reduced muscle support around the spine and hips. Research involving thousands of older adults has found that inactivity and muscle loss, sarcopenia, play a major role, with one major study in the Journal of Gerontology reporting that weaker glute and core strength directly correlates with higher rates of persistent back pain. But here's the truly reassuring part. Clinical trials and meta-analyses from sources like the Cochrane Database and the American College of Physicians consistently show that targeted strengthening exercises, especially those focusing on the muscles that stabilize the spine and pelvis, can significantly reduce pain and improve function in older adults, often more effectively than medication or passive treatments alone. Large studies of people in their 60s, 70s, and beyond have demonstrated pain reductions of 30–50% and better daily mobility after just 8–12 weeks of the right gentle exercises. Most importantly, the evidence points to one exercise in particular that research highlights as especially effective at activating the key muscles most responsible for back stability. One highly effective exercise that research frequently includes in programs for people over 60 with back pain is called the glute bridge, sometimes just called the bridge. It's a gentle, floor-based movement that specifically strengthens the glute muscles, your buttocks, along with the core and lower back stabilizers, without putting stressful compression on your spine. Here's why it's so powerful. As we discussed, much of the back pain after 60 comes from weakened glutes and core muscles that no longer properly support the pelvis and lower spine during everyday activities like standing, walking, or bending. When the glutes are weak, other muscles, like those in the lower back, have to overwork, leading to strain and discomfort. The glute bridge directly activates and strengthens these key glutes while also engaging the deep abdominal muscles, helping restore better pelvic alignment and spinal support. Done correctly, it takes pressure off the lower back and builds the stability your body needs for comfortable movement. Picture someone like Barbara, a 68-year-old grandmother who had been dealing with nagging lower back pain for years, making it hard to play on the floor with her grandkids. She started doing simple glute bridges at home a few times a week, and within a couple of months, she noticed she could bend and lift more easily without that familiar ache. Stories like Barbara's are encouraging, and they're supported by strong evidence. Clinical research, including randomized trials reviewed by the Mayo Clinic and NIH, shows that exercises targeting glute and core strength, like the bridge, can significantly reduce chronic low back pain and improve function in older adults. A systematic review of studies on stabilization exercises, which often include bridging movements, found meaningful pain reductions and better daily mobility in participants over 60. Large meta-analyses published in journals like the Journal of Orthopedic and Sports Physical Therapy confirm that core and glute-focused strengthening leads to 20–40% improvements in pain scores and disability measures for nonspecific low back pain, often outperforming general stretching or cardio alone. Studies involving hundreds of adults with chronic back pain have demonstrated that regular glute activation exercises increase muscle endurance and reduce inflammation around the spine, with one review noting benefits comparable to other conservative treatments, but with fewer side effects. But here's something most seniors are never told. Weak glutes are one of the most overlooked contributors to persistent back pain after 60, and strengthening them with a simple move like the bridge can make a bigger difference than many common stretches that only provide temporary relief. Now, let's look closer at the science behind why the glute bridge works so well, and why it's often highlighted as especially beneficial. In biomechanical studies, the glute bridge has been shown to highly activate the gluteus maximus, the largest muscle in your body, while keeping lower back strain low when performed properly. Always consult your doctor before trying new exercises, and stop if you feel pain. Research using electromyography, EMG, to measure muscle activity found that bridging exercises effectively target the glutes and core stabilizers more than many traditional back exercises, helping redistribute forces away from painful areas. A randomized controlled trial with older adults experiencing low back pain showed that incorporating bridging into a program led to significant improvements in glute strength and reduced pain intensity by around 30% over 8 to 12 weeks. Meta-analyses from sources like Cochrane and the American College of Physicians support that stabilization programs, featuring bridges and similar moves, provide moderate to large reductions in pain and better long-term function compared to minimal intervention. Here's the surprising part almost nobody knows. While many people focus only on stretching the back, evidence shows that building glute and core strength often brings longer-lasting relief because it addresses the root weakness rather than just masking symptoms. Let's walk through exactly how to perform the glute bridge safely and comfortably at home. No equipment needed, just a soft surface like a carpet, yoga mat, or even your bed, if getting down to the floor is challenging at first. Start by lying on your back with your knees bent and feet flat on the floor, hip-width apart and about a foot away from your buttocks. Place your arms relaxed by your sides, palms down. Take a gentle breath in, and as you breathe out, slowly tighten your abdominal muscles as if drawing your belly button lightly toward your spine, then squeeze your glute muscles and lift your hips toward the ceiling. Aim to create a straight line from your knees through your hips to your shoulders. Don't push so high that your lower back arches excessively. Hold the top position for 3 to 5 seconds while continuing to breathe normally. Then slowly lower your hips back down without fully relaxing until the next repetition. Begin with 8 to 10 repetitions, resting briefly between each if needed. Perform 2 to 3 sets, 3 to 4 days per week, giving your muscles a day of rest in between. As you get stronger and more comfortable, usually after a few weeks, you can progress by holding the top position longer, up to 10 seconds, adding more repetitions, up to 15, or trying gentle variations like marching one foot off the floor at a time while keeping hips level. Common mistakes to gently avoid: pushing up primarily with your lower back instead of your glutes. Focus on feeling the squeeze in your buttocks first, or lifting too high and overarching, which can add strain. If you feel any sharp pain, different from mild muscle effort, stop immediately and consult your doctor or a physical therapist. Always consult your doctor before starting this or any new exercise routine, especially if you have osteoporosis, recent surgery, or severe pain. Research supports this gentle progression. Studies of progressive stabilization programs that include bridging exercises have shown 35 to 45% reductions in pain and significant improvements in daily function after 12 weeks in adults over 60. Another large review in Physical Therapy Journal confirmed that low-load, progressive core and glute exercises like the bridge are safe and effective for older adults, with very low risk of aggravation when done mindfully. Many seniors report real, lasting changes. For example, think of someone like Tom, a 72-year-old retired teacher who started with just 5 careful bridges a day. After a month, he could garden longer without that deep ache, and by 3 months, he was enjoying longer walks with his wife again. Clinical studies back this up, one involving over 200 older adults with chronic low back pain, showed that consistent glute bridge practice not only reduced pain, but also improved balance and reduced fall risk, important benefits as we age. To make the results even better, combine the bridge with a few supportive habits. Take short walks most days to keep everything moving, sit less and stand or change positions often, and be mindful of posture. Imagine a gentle string pulling the top of your head upward while keeping shoulders relaxed. These small additions amplify the strength you're building. Here's where it gets even more hopeful. Most people notice the first signs of relief within 2 to 4 weeks, and the benefits continue to grow with consistency. You've now learned the highly effective glute bridge exercise, one simple, research-backed movement that targets the key muscles so many of us need to strengthen after 60 to ease back pain and move more freely. By gently building glute and core stability, you're giving your body the support it needs to handle daily life with less discomfort and more confidence. Remember, you're not alone on this journey, and it's never too late to start making positive changes. Small, consistent efforts with the bridge, done safely and at your own pace, can bring meaningful relief, better mobility, and the joy of doing the things you love without pain holding you back. You deserve to feel comfortable and strong in your body. Thank you for trusting this guidance today. I truly believe this can make a real difference for you. Start gently, listen to your body, and celebrate every bit of progress along the way.